flu, and the Surgeon General announced today that he is recommending that everyone get the flu vaccination this year. Dr. Ahmad, first off, what is the flu for those of us who don't know?
The flu is a respiratory virus. It's either it's influenza, it's type A or type B, and it causes respiratory illnesses, mainly in the respiratory passageways and possibly the lungs.
Okay, and what are some of the symptoms for those of us who've been lucky enough not to have the flu? Because unfortunately, a lot of folks out there have had it, and it can be very debilitating,
yes,
and in fact, very deadly. About 80,000 Americans died last year from the flu, is the report.
Yeah, the symptoms are fever, obviously, muscle aches, body aches, chills, maybe a runny nose, sneezing. Sometimes you can get upset stomach, nausea, diarrhea. But high fevers, body aches are the two big ones.
So, we're still here in the end of September. It's even some Indian summer out there, even though we're in the fall. It's not winter, but it is time to start thinking about getting that flu vaccination. Talk a little bit about who is the right person to get that vaccination.
Okay, well, just basically anybody 6 months and older should get the flu vaccine. Now, there are higher risk population that should definitely get it, but the CDC recommends anybody older than 6 months should get the flu vaccine.
Yeah, and it's especially very deadly for our very youngest and our more mature members of society. Mm-hmm. Why is that?
Well, because they're more prone to complications, such as pneumonia. If they have underlying diseases, they can exacerbate them. Like if they have heart disease, they're more prone to getting heart attacks. Diabetes, things, if underlying diseases can get worse if they have the flu.
So basically, the healthier people have a little bit better chance to kind of survive the flu and make their way through it, even though it can be a doozy for even the very healthiest of us.
Yes.
For the most part, is it a shot?
Before the last flu season, the CDC was recommending the shot. This year, they're recommending get anything, the nasal spray or the shot, whatever is age appropriate for you.
Okay. And is there anyone who should not or does not qualify to get that shot? Obviously, anybody over 6 months, but say I have an egg allergy, or a lot of people say, I don't want to get it because I don't think it's working, or it makes me sick.
Yeah. Well, the CDC recommends even if you have an egg allergy, you should get it unless you have a severe egg allergy like anaphylactic or angioedema or throat swelling, difficulty breathing. But if you just had hives or rash, you should still get the flu vaccine even if you have the egg allergy. And as I said, everybody over 6 months should get it.
So if someone's seeing this today and they say, oh my gosh, I haven't gotten my flu shot, can they come here to you?
Yeah, they can definitely come and get the flu shot. You can even get the flu shot well into the flu season. They recommend getting it by at least the end of October because it takes about a couple of weeks to kick in. And peak flu season's around January, February. So you want to try to get it before then, but even if you get it in January, February, we have been seeing cases up all the way up till March, end of March. So even if you get it late, you will still get some protection.
So the sooner you get it, the better off it is. Kind of maybe it builds up maybe a little bit of a immunity to it.
Exactly. Okay,
great. And as we know, last year there were several different types of flus out there, so it kind of even morphed within the season, it seemed like. Yes. And I've known many people who said, oh, well, I got the flu shot, but then they eventually down the line did get a case of the flu.
Yeah. Well, they say even if you've gotten the flu shot and you do get the flu, it will be milder. It won't be as severe. So there's still advantage of getting the flu shot. Even if you get the flu, it will be milder.
Dr. Ahmad, how long have you been serving the Woodbridge community? Here we are in Lake Ridge. For those of you who don't know, we are at the corner of Minnieville. And we're right there at the Sentara Lake Ridge site. It looks like it's just a standalone ER, but in fact, there are office buildings on top of the ER. How long y'all been here, and how long have you been serving the community?
Well, I've been, this office up here has been here about 7 or 8 years, I believe. I think that's when the ER was opened downstairs, and I've been here about 5 years.
Okay, wonderful, wonderful. What do you want people to know if they're catching this for the first time or meeting you for the first time?
Well, about the flu or?
About anything. We've got a captive audience here.
Well, as I said, we want to let people know that we are up here. We do primary care. I'm internal medicine, so anybody 18 and older. I tend to specialize in chronic diseases such as diabetes, high blood pressure, heart disease, things of that nature. But anybody 18 and older, and we are up here on the second floor on top of the
Wonderful. And as you were mentioning some of those kinds of conditions, those are folks who really should be getting the flu shot because maybe they have a compromised health. So as the Surgeon General put it out today, anybody over 6 months of age, especially our very young and our more mature members of society, should definitely be getting their flu shot this year. Really, this is the ideal time to get it, especially sometime here in October.
Yes.
All right, Dr. Ahmad, thank you so much for your time today. And if you'd like to learn more about Dr. Ahmad, I have placed his phone number within this Facebook message. And of course, you can call here anytime. You can also go to our website, which is Sentara.com. Thanks, everybody. Be safe out there, and we'll be talking to you soon.